I always wanted to be a physician since I grew up. My father's a physician, and I really admired how he carried himself and how he cared for people, which always left a positive impression on me at dinner table conversations, like hearing about like just patients and stories and people being diagnosed with something and then getting better. We're always telling stories about ourselves and others. So people's desires for therapy or what they want in life come through. And it depends on someone's age and their background and who they're with. We try to meet people where they are. There's a high degree of honesty and clarity in that I think is maybe perceived as being really real and authentic, and it is. So I think it's really changed my life because of how serious and raw our interactions are all the time. And I think people come to Siteman to get the best possible care. We'll go as far as the patient wants to go. So, whatever they want to do, we will, facilitate that in the best way we can. And I think I try to go into every patient interaction with a blank slate because you never know what someone's life is, or you may think but we're all open books and very deep wells of emotion and knowledge and experience that it just takes time to work through. I love dictating stories, right? It's like when you finish the visit and you do the social history. It's like you're just dictating who someone is, who they're with, like what their kids do if they have kids, or if not, what their hobbies are, and it just makes someone come alive. It's that's a natural bridge to empathy and to providing the best possible care for them, is meeting them where they are. So whenever I meet someone for a consult, it's like someone starts off as a name and a diagnosis, and at the end, you know so much about them, even from an hour conversation. That understanding just keeps getting deeper and deeper with every subsequent visit, and walking someone through a really harrowing time in their life potentially. It's an amazing career. It's unbelievable that I get to have this job. The people you meet and the diseases that you get to treat are just fascinating beyond measure. And I think that also parlays into my academic mindset, because I've always had an inclination for growth and developing myself, in whatever way possible, whether that's personal development or training. I like to run and cross-train and push myself physically and then mentally. I think so with research in that avenue, I feel like my career is a really nice dichotomy of seeing patients and having the clinical experience be the source of questions to research and how to improve care. It's the best possible job one could have. Nothing even I would change about it. But really, jobs change, the nature of your work, the treatments, the research, but really it's the people. So I feel like I wake up in the morning for the people I work for and with. We are all, part of something, and it's something beyond just your day-to-day life. It's you can see even doing little things, every note I dictate, I try to do the best I can because it means something to that person's story. You want to honor their story if they came in to see you, and the little details of what they tell you matters a great deal to them, and also matters for communication with your team. So I think there's just a lot of little things that are actually not little. They're major aspects of someone's life. And I'm glad that we as a culture want to support someone's entire life, not just their disease. Yeah, I really love working at Siteman. I'm so proud to be part of this organization, both Washington University, Barnes-Jewish Hospital, and Siteman, just as very collaborative institutions that I think have a big heart on the inside. Everyone that I interact with and that my peers interact with really cares about patients. So no matter what field they're in, whether they're directly dealing with patients or doing the basic science research that fuels the clinical discoveries, there's just a high degree of empathy and teamwork. And I think it's my favorite part of being here, is that I feel like I'm part of a team doing something bigger than myself. So my purpose is being lived every day, and the purpose is a shared purpose of trying to make life maximally good. And it just comes across in just the warmth of the collaborations that you get. It's fun to work with patients and their families and say, I'm gonna call you about this, and my coordinator is gonna help you with this, and to see a patient's face knowing that they're gonna be supported from multiple aspects of their care, whether it's the dietitians, pharmacists that come in and counsel patients, my coordinators that do so much of the heavy lifting in terms of making calls and coordinating schedules and making sure that, patients have a direct number to call at any time of the day and not an automated service. I think that's just really the kind of personalized care that I would hope for a family member, for myself, if anything ever happened. There's a really kind culture. I think patients do tell me that they'll say, so-and-so was very kind to me in a moment of distress. And someone put my hand, put their hand on my shoulder and let me talk for a little bit and voice myself. So I think it feels like it's very warm and not machine-like or corporate, that we really do care about a purpose, and the purpose is just to, be the best we can be at our own individual level. I think there's a sense of pride in ourselves individually and then what we represent. So if I wear this white coat, it's because I'm allowed to work here and be part of a really great team. And it's a really just wonderful job that I'm allowed to have. So I want to be part of something and add value in whatever I do.